For me, a lot of joy comes from relieving pain. And a big part of anesthesia is pain management. Being able now not just to relieve pain, but to teach our anesthetist students, our anesthesiology residents, the significance, the importance, and how to work to relieve that suffering. My name is Greg Sund. I'm an anesthesiologist working at AIC Kijabe Hospital in Kijabe, Kenya. I'm one of two anesthesiologists at Kijabe Hospital. My primary role is one of education, but also consulting in the operating room, helping with procedures, nerve blocks, and also resuscitations. Every day, patients all over Africa are suffering and sometimes dying from lack of access to safe surgery, but also safe anesthesia. If you are a child coming in for surgery, your risk of dying is 11 times higher. And if you are a pregnant woman coming in for cesarean section, your risk of dying is 50 times higher than it is in high-income countries. A lot of these deaths are not from surgical complications, but from anesthetic complications. There are significant obstacles in terms of just having the right monitors to monitor patients' heart rate, blood pressure, oxygen. But even with those monitors, there's still gaps in training, especially in how to recognize and respond to some very common life-threatening emergencies. And it's our vision to address those gaps in anesthesia and safe delivery of anesthesia care and monitoring of patients having surgical procedures. We want to invest in 3 mission hospitals in Burundi, Malawi, and Uganda with a bundle of interventions that include support for equipment, expand access for patients to surgical and anesthesia care, but also investment in education of nurse anesthetist providers, but also physician anesthesiologists at these sites. When I first started doing short-term trips to Africa, we were helping a number of patients, but the impact of what we did ended when we left. My goal is to train anesthesiologists who will replace me. If you can teach an anesthesiologist not just to be a good anesthesiologist, but also to be a teacher, then the impact is multiplied. And that curve over the course of 10 to 20 years goes up exponentially.
Dr. Greg is a very good teacher and trainer of anesthesiologists and of anesthetists. He started this residency program, which is very successful now. We have 2 different training programs here. We have nurse anesthetists. The other training program is anesthesiologists, so they're learning to practice anesthesia and supervise other people in anesthesia, conduct research, think about systems, things like that. So he is training at both of these levels, simultaneously assuring quality among all the trainees at the same time.
A Kenyan working at Kijabe understands so much better than I do the challenges that our patients face, the systems that are in place. So through the support of African Mission Healthcare, we have residents not only from Kenya, but also from Ethiopia, from the Democratic Republic of Congo. Training them and preparing them for the challenges that they're going to face is going to be crucial to the success of this vision.
Training from AIC Kijabe Hospital has been a great experience so far for the past almost 2 years that I've been here. Being trained under Dr. Greg has been a privilege for me. I've learned a lot of anesthesia. Of course, there are a lot of clinical skills, a lot of technical skills. Anesthesia training, when you're starting out first time, things can seem very complicated and very difficult to do. But Dr. Greg has a way of teaching you and showing you how things can be so easy by the end of it. The way he approaches it, the way he teaches it, we understand it very well. This is one of the qualities that I've really appreciated training under Dr. Greg.
I'm incredibly grateful to African Mission Healthcare for awarding me and our team here this L'Chaim Prize. We do believe that this gift, this investment will have a huge impact, not just on the 3 hospitals that we're going to be investing in, but we do believe that that impact will affect the wider communities. It's our hope that if we can raise more support we can replicate what we're doing at these 3 sites at other sites in Kenya, in South Sudan, and Sudan. Through that investment and that wider impact, the larger health community within Africa will see what investment in these hospitals can do and what impact it can have on the patients that they're treating.